If you are experiencing a combination of stomach pain, bloating, and back pain, there are a number of possible explanations you need to be aware of. These symptoms could indicate a serious problem that needs to be addressed immediately. Irritable bowel syndrome. Irritable bowel syndrome, or IBS, is a fairly common intestinal disorder, but it can be debilitating for many people. This condition has been known to cause bloating, back pain, nausea, diarrhea, excessive gas, and constipation. While IBS is not life-threatening, it can be extremely difficult to live with. Fortunately, there are numerous treatments that have been proven effective in treating this condition. Gallstones. Gallstones are solidified deposits that are found in the fluid of one's gallbladder. While some people pass these stones on their own, others require surgery to remove them. The most common symptoms of gallstones include nausea, indigestion, back pain, and abdominal discomfort. Kidney stones. Kidney stones are solidified deposits that are found in the kidneys. These stones can also be passed, but in some cases surgery is needed. They pass through the urinary tract, which can be quite painful. Back pain and stomach pain are common signs of this problem. You may also experience nausea, vomiting, and pain during urination. Appendicitis. Appendicitis is a condition that occurs when the appendix becomes inflamed. The buildup of pus causes moderate to severe pain. It is important to seek immediate medical attention if you notice the following symptoms: belly pain on the right side, sharp or dull, bloating, back pain, loss of appetite, fever with chills, fatigue. Surgery is required to treat appendicitis. Afterwards, antibiotics are prescribed to prevent further infection. This can be fatal if it is not treated immediately. Acidity. Acid reflux is a common but potentially serious condition that is commonly known as heartburn. This condition causes acid from the stomach to come up through the food pipe. Some of the more common symptoms include a burning sensation in the chest, bloating, bitter taste, and dry cough. In some cases, acid reflux can cause back pain. Gastrointestinal reflux disease, or GERD, can be easily treated with a prescription anti-acid medication. There are also over-the-counter antacids that are very effective. If you have a burning sensation in the chest along with bloating and back pain, there is a good chance that you have this particular issue. It is important that you see a doctor to get an official diagnosis and treatment. Urinary tract infection, UTI. A urinary tract infection is an infection of the urethra, bladder, or kidneys. While this type of infection is most common among women, men can get it too. Some of the most common symptoms of a UTI include pain when urinating, cloudy urine, persistent urge to urinate, foul-smelling urine, fever, fatigue. In some cases, someone with a UTI might experience bloating and back pain. If you're experiencing these symptoms in addition to the ones listed above, you should seek medical attention right away. These infections are usually not serious, but they can become life-threatening if left untreated. Antibiotics are typically prescribed to treat the infection. The most effective way to prevent UTIs is to urinate immediately after sexual intercourse. Celiac disease. Celiac disease is classified as an immune disease that results in sensitivity to gluten. Those who have this condition can experience a variety of symptoms after ingesting gluten, including indigestion, bloating, nausea, vomiting, fatigue, diarrhea, excessive gas. Some people with celiac disease also experience joint and back pain. While this is fairly uncommon among celiac sufferers, it is something to keep in mind. The best treatment for this condition is to avoid foods that contain gluten. Fortunately, there are tons of gluten-free food options available in grocery stores and restaurants across the country. Fibromyalgia. Fibromyalgia is a condition that causes musculoskeletal pain throughout the body. Some of the other common symptoms of this disorder include fatigue, memory problems, and sleep issues. Some people also experience bloating, gas, and abdominal cramping. There are a variety of medications and therapies that can be highly effective at managing the symptoms of fibromyalgia. Physical therapy is highly recommended and can help with reducing pain and improving overall mobility. If you think you might have this condition, it is important to see a doctor right away. The sooner you begin managing your symptoms, the better off you will be in the long term. Final thoughts. While bloating and back pain might not seem very serious, they can be symptoms of a much larger problem. It is important that you see a doctor immediately if these symptoms worsen. Your physician will be able to determine the cause of these symptoms and recommend an appropriate treatment. For questions about the video, comment below. If you enjoyed the video, give it a thumbs up and share it with your friends. For more health facts, subscribe to the channel.